friends, today our topic of discussion is on the complications of blood transfusion. Before that, you should know what is blood transfusion. See, blood transfusion is a routine medical procedure. It is the process of transferring the blood products into the person's circulation. How? Intravenously. So this is potentially a life-saving procedure and can help to replace blood loss due to surgery or injury, or used for the various medical conditions to replace lost components of the blood. So this is all about the blood transfusion. Next we will discuss about the complications of blood transfusion. Complications of blood transfusion. See, complications means the side effects or the adverse effects which occurs during or after the blood transfusion. What are they? Let us discuss one by one. First is transfusion reaction, second circulatory overload, third septicemia, iron overload, disease transmission, hypocalcemia and citrate intoxication and hyperkalemia. Let us discuss one by one in detail. First is transfusion reaction. See, transfusion reactions are the adverse events associated with the transfusion of the whole blood or one of its components, like fever, chills and urticaria, etc. Next is our circulatory overload. See, circulatory overload is the transfusion reaction. It's a common transfusion reaction resulting in the signs or the symptoms of excess fluids in the circulatory system, also known as hypervolemia, within the 12 hours after transfusion. So it is caused by the infusion of the blood at a rate too rapid for the client to tolerate. Okay. Next is septicemia. Septicemia means infection in the blood, or is a serious blood infection. What happened? It's a life-threatening complication of an infection. What is it? The presence of the infective agents or their toxins in the bloodstream. So septicemia occurs with the transfusion of the blood that is already contaminated with the microorganisms. As I told, septicemia is a serious infection and must be treated promptly. Why? Otherwise the infection leads to circulatory collapse, profound shock and death may occur. Next is iron overload. That means too much iron in the body, also called hemochromatosis. It is a condition in which your body stores too much of iron. It is a delayed transfusion reaction that occurs in the clients who are chronically dependent on blood transfusion, such as the clients with anemia or thrombocytopenia. Next is disease transmission. See, infectious diseases are transmitted from person to person. How? By direct or indirect contact. So the diseases commonly transmitted are hepatitis C, hepatitis B, HIV, human herpes virus, Epstein-Barr virus, cytomegalovirus and malaria, etc. That is why we do the donor screening before blood transfusion, just to reduce the risk of transmission of infectious agent. Next is hypocalcemia and citrate intoxication. Before that, you should know what is hypocalcemia. Hypocalcemia, you all know that hypo means low, calcium in the, emia means blood, low calcium in the blood. That means hypocalcemia is a serum calcium level less than 8.6 mg per deciliter. See, the citrate in the transfused blood binds with the calcium and is excreted from the body, which leads to the condition known as hypocalcemia. Okay, so hypocalcemia may occur. Then next condition is hyperkalemia. Hyperkalemia also you all know, hyper means high, kalemia means potassium in the blood. So hyperkalemia is a serum potassium level that exceeds 5.1 milliequivalent per liter. So you all know that the lifespan of the RBC is 120 days. After that hemolysis occurs. So the serum blood liberates potassium through hemolysis. Okay. So the older the blood, the greater will be the risk for hyperkalemia. Okay, therefore the clients at the risk for hyperkalemia, such as those with a renal insufficiency or a renal failure, should receive fresh blood. Okay, otherwise the condition will lead to hyperkalemia. So this is all about the complications of the blood transfusion. Hope it is clear to you all. In our next video, we will discuss about the complications of the TPN, that means total parenteral nutrition. Have a good day.